Hello, hello, hello. Dr. Dylan here, coming to you from none other than Miami. I want to tell you all about today what to do after your procedure. What you do after your procedure is so very important. Let's talk about first, and everybody knows about this, it is the compression garment. After your surgery, you immediately go into a compression garment. We want to make sure that you're fully measured prior to your surgery. And that can be on your pre-op, it can even be the day of surgery. There are two different types of garments that we have. One is considered a first stage garment. The second is considered a second stage garment. The difference between the two is that the first garment is very, very, very compressive. It's really designed to squeeze as much fluid as possible and decrease the swelling. About 2 weeks later, you get a second stage garment. Patients love the second stage garment. The second stage garment doesn't have any clips or clasps. It's much more comfortable and you can wear it. This might be some of the reasons why people wait for the colder months to have their surgery, and I certainly can understand that. But understand this, it's in the summer months that we give most of our specials, okay? The garment is very, very important. It is as important as the surgery. You may actually go down 1 size, 2 size, and I've seen patients go down even 3 sizes after the garment. Now let's talk about when to shower. Everybody wants to know when can they shower after surgery. Well, the first thing I want you to do is if you're going to shower the very first day after your surgery, have somebody take you to the shower. Have somebody accompany you to the shower, because a lot of times patients are dehydrated after surgery and they're not really drinking a lot of fluids, okay? So we like to wait 48 to 72 hours after your first shower. Not everybody follows this instruction. It is recommended that we wait 48 to 72 hours after your surgery before you shower. Do not bathe under 2 weeks. Wait till after 2 weeks to bathe, because some of your incisions may be open, especially if you're receiving massages. Okay, we don't want any of that water to seep into your incision. You should expect a lot of drainage. Drainage is normal. We don't take out all of the fluid that we put in. We take out sometimes 80%. And if you think that, if you figure that we might be putting in 6 liters, right, there may be a significant 2 liters of fluid that you're going to drain. Drainage is normal. It's not abnormal. Sometimes it's red tinged. That's normal. You're not bleeding, okay? Now, if you're just pouring out dark red blood, that's a different thing. But the drainage is going to be like it'll look like red Kool-Aid, okay? Sometime 24 to 48, maybe 72 hours later, you'll see some bruising, okay? Bruising is normal. Bruising is normal, bruising is normal. It'll look like kind of like purplish or reddish, and it goes away in about a week. For most of my patients, I like to see them post-operative day 1, make sure everything is going along fine. In some places, I work in centers where you can come in a week later and that's fine. One of the reasons why I like to see patients immediately post-operatively is because, especially if they're undergoing general anesthesia, it gives us a chance to check you out and make sure that you're drinking fluids and everything else is okay. So now let's talk about swelling. Post-operative day number 1, it might not look like anything was done. Why? Because you'll have swelling. Swelling is normal. How many times have you ever seen a boxer go into a boxing match and by the 12th round their face is swollen? That's a part of the process, actually, of normal healing. Because what your body is doing, it's bringing into the area a lot of healing elements. And it brings into the area those healing elements with water. And that water is called swelling. Now, keep a Band-Aid on all of the entry points Okay, those entry points will drain, but just kind of keep it covered. And you can even go to like Walgreens or CVS and buy something called bacitracin, and the bacitracin will also help those areas. Okay, now it's important to get a good night's sleep, but it's important for you to understand that while you're sleeping, you're not drinking fluids. Okay, so that means when you wake up, and sometimes even if you want to be, somebody to wake you up maybe around 11 or 12, just drink a whole lot of fluid. Very, very important. Now, a lot of people talk about going back to work. Okay, when can they go back to work? When can they go back to work? This is what I like to say. A lot of people are working from home these days, and you can work from home. If you're not on narcotics, you'll be able to answer questions, maybe, work from home with a clear sense of mind. In terms of getting out and going to work on your own, you got to know that you can't drive a car while you're on narcotics. Okay? Now, there are medications that we give that are not narcotics. Those include something that's called gabapentin, and it also includes Toradol. Okay? Gabapentin, if it comes in a 300 milligram tablet, you can take 6 tablets in one day. Toradol we also give, that's 10 milligrams per day. And between those two, a lot of patients don't even need narcotics. So your discomfort level, a lot of patients will say it feels like they had a very vigorous workout, okay? So if that's the case, usually we'll find people that'll go back to work in a week. That's not across the board, everybody varies. Sometimes patients need 2 weeks, sometimes patients need 2 days. It all depends upon your pain tolerance, okay? I would say that if you have any doubt about your pain tolerance or anything like that, I think a week is more than enough. In fact, 3 days could actually be good. Let's talk a little bit about medications that you should not take before surgery. Here are the big ones: aspirin, Motrin, vitamin E oil, fish oils. Okay? If you're on heparin or you're on Coumadin, you need a full medical clearance from your hematologist. Okay? The other thing that we also see is we see a lot of patients who are anemic. And some of these women, they'll need iron infusions. So if you can get your hand on some over-the-counter iron, go ahead and take it. Stay tuned for more videos. I appreciate you all. And remember this, you are what? Beautifully made. Don't forget that.